Hi, so you're an administrative assistant who's been having elbow pain and seems to have a lateral epicondylitis. So this condition is the inflammation and or thickening of the muscles of that start on this side of the elbow that you've been having pain and attach all the way down to your wrist and do this movement of bringing your wrist up and sideways when you're when the palm of your face is pointing down. So the mechanism of injury for this condition are repeated stresses and improper techniques or positions, prolonged positions of your wrist for prolonged periods of time. The reason why you've been having pain, especially when grabbing things, grabbing your coffee mug, driving and typing, is because in this position, you're stretching the muscle that's being affected. That's a little bit tired because of all of that increased demands that you've been putting on. And I also see in your chart that you have decreased strength with the muscles that do this movement and the muscles that do that movement. So basically, the primary action of that muscle is going up. So that this muscle is tired, it's been having a lot of demand. And there might be some changes in the tendon that can affect its ability to contract by doing its primary movement, like I said. And when you're coming like that, so bring your wrist out, flexing your wrist with your palm facing up and adding weight is going to be uncomfortable and painful, and you're going to have decreased strength because you're stretching these muscles. It's also written that you have a strong sensation with when I do it and when you do this movement, so bring your wrist down with your palm facing down, and that is because what I said, you're stretching the muscles and the tendon that's been affected. I also see in your chart that you have a limited ability to bring your wrist up actively, but you have the full range when I do it for you. That is normal because when you do it yourself, you're engaging those muscles to bring the wrist up. But when I do it, we're subtracting that necessity of the muscle to contract to bring it up since I'm doing it for yourself. I also see that you have elbow pain, about a 2, when you go in full range of extension, when you do it. So that is because if we look at the origin of this muscle, when we stretch it like that, we're a little bit elongating the fibers, so that might cause discomfort, but you have all your range, so that's a good thing. It's also written that you feel some pressure when you and I bring your elbow in this motion, which is normal because of the swelling that's been there, because of the pressure that's been caused by the inflammation, the healing process. So when we go like that, you're gonna feel pressure. It's normal. So what we're gonna be doing is working on your ability to move up and down in order to increase circulation, in order to prevent contractures and keep the ability of your muscles and all your tissues that are around to go in these motions, so you can be functional and we can decrease the risks of injury around that area. And the next thing we're gonna do, we're gonna strengthen those muscles, and not only to the previous state when they were, but also beyond the point of when you first before you felt the pain, because we want you to have the strength and the endurance that you need for your activities of daily living. We're gonna work on the muscles around for strength to make sure nothing is these muscles are not compensating for the lack of strength of structures, contractile structures, so your muscles around. We're also going to work for flexibility to align the fibers of that muscle, and also flexibility of the muscles around to make sure nothing's tight and compressing that area and that muscle that's been affected. And ultimately, we're going to work on your ergonomics, so how you type to make sure you're not keeping your wrist in a prolonged position like that or like that, but rather neutral. So that's what we're doing, and after we're gonna might work a little bit on exercises for stability, and the main thing for now is gonna be the pain management. Thank you.